Hi, my name is Allison Ariel. I'm the course instructor for the upcoming course, Rehabilitative Ultrasound Imaging for the Pelvic Floor and Pelvic Girdle. I'm here to answer some questions regarding the course. The first question is, what can you expect to learn from this course? In this course, you're going to learn to use ultrasound imaging as a clinical tool to use in your everyday practice. The ultrasound imaging is a really neat tool that you can use as both an assessment tool for the practitioner and as well as a biofeedback tool for the patient. The practitioner can use it as an assessment tool to assess the pelvic floor, the lumbar multifidus, the transverse abdominis, and the rectus abdominis to see if the patient is using the correct strategy or if they're using incorrect techniques in trying to activate their local core muscles. The patient then uses the images that they see on the screen of the ultrasound as a biofeedback to learn to properly contract those muscles. So many people are visual learners, and having that visual feedback of what's actually happening inside their body can make a huge difference for the patient in learning to fire these muscles correctly. The next question are labs. What can you expect in labs? We will be doing hands-on learning. We will have some ultrasound machines available where we'll break up into groups and we'll get on the ultrasound machine and learn how to image the muscles. You will learn how to image the pelvic floor muscles and see if someone's doing a correct strategy, as well as using it as a biofeedback method for patients to learn to do. We'll learn how to do the transverse abdominis and image this and to see whether or not someone's getting a little bit too much compensation with their internal oblique. We'll learn how to measure their interrectus distance. We'll also learn how to view and measure as well as help activate the lumbar multifidus. All of these muscles help with stabilization. So in this class and in these labs, you're going to learn a really complex stabilization program that can help patients with back and pelvic and SI joint pain get better and stay better. We do have a few transperineal labs where we look at the anterior compartment. We'll look at the bladder base. We'll look and see what's happening when someone does a Valsalva as well as a contraction. We're going to see how much someone's bladder is dropping and if they're having some funneling of the urethra. So you start to learn some of the anterior compartments and the transperineal imaging as well too. The labs are fun because we're hands-on using the ultrasound and everyone gets to see how they're doing as well as learning how to treat your patients better with this fun tool. Taking this course can change the way you treat your pelvic floor patients forever. When you can see with your eyes what is happening when you're trying to retrain the pelvic floor or the transverse abdominis, you're going to see what you've been missing. Using ultrasound imaging as a biofeedback tool, patients absolutely adore. So adding this to your clinical practice will not only change the results and the excitement that you have for your patients, but your patients' excitement to come to physical therapy. When you have an ultrasound, you can expand your program to patients that you haven't been able to reach before. You have those pelvic floor patients that need help, but they're too modest to ask for help because it's in an intimate area. You can treat patients with weakness. So your pelvic floor prolapse patients and your incontinence patients, you can treat without ever having to have them disrobe. Imagine that. Your patients coming in, getting better, curing their incontinence, and they never had to take their clothes off. You can start treating adolescents and children without having to worry about taking their clothes off. So it's going to expand your practice in ways that you never thought of. Another thought is when you use ultrasound imaging, you really are learning a stabilization program in this class that has been shown in research to help patients with back pain. So your chronic pelvic pain patients that have sacroiliac joint dysfunction as well as lumbar spine dysfunction are going to see improvements in that. I'll tell you, I've had a neurosurgeon start sending all of his back pain patients to me, to my pelvic floor program, because his patients were getting better with back pain. So you might start getting patients for back issues, not just your pelvic floor issues as well too. Having this ultrasound, you're not only going to get your patients on board, but you're going to get the surgeons and you're going to get the doctors on board and referring to you. So you're going to expand your practice beyond how you ever thought you could. It's a very exciting tool to use, both clinically as well as if you want to get into research, you can start using this for research as well. It's a great program to add, or it's a great clinical tool to add to your program, and you'll be excited to see the results that you get. The next question I'm going to answer is, but Allison, I don't have an ultrasound machine. And I want to tell you to think outside of the box. There are ultrasound machines that are a lot cheaper than the ones that are $20,000 or even more than that. There are ultrasound machines that are a lot cheaper from South Korea. There's a new one coming out from the United States that is much more affordable, and it's on a little tablet and you can carry it around in your laptop. The other things to think about is I've had people set up programs and helped them set up programs sharing a machine with another clinic. I've had other people set up programs with borrowing a machine from an OBGYN clinic that they had a good relationship with. Not all OBGYNs use their ultrasound machine every day. Often they're only using it one day a week. So physical therapists can go in and rent that time with that machine or borrow their machine from the patient. I've worked in clinical settings in the past where I shared an ultrasound machine with a surgical department, and they used it some days a week and I used it other days a week. Additionally, think about how much that doctors' offices are getting in when they're trading in their machines. They don't get very much money for those machines. So if you approach those doctors and when they are upgrading, you might be able to get a machine for very cheap from that doctor. Instead of having them trade it in, they could sell it to you and then they buy a new machine. Often what's not good enough for a doctor is good enough for a pelvic floor physical therapist. So it's a lot easier to get a machine than you think. If you work in a hospital setting, there's machines that are within the hospital system that they often can just transfer when the doctors are not using them anymore to your department. So think outside of the box. And I have had so many people take this class and go back and be able to secure a machine to be able to use, whether it's a few days a week or permanently in their office. If you think outside of the box, it's very exciting to be able to get this tool to supplement and to add different techniques to your program.